Who wants to go over some recent board exam boot camp questions? So we had our recent board exam boot camp just this past Sunday. The recording is now posted for VIP members. You get complimentary access to any class anytime throughout the year. But I want to go over a couple questions with you as well, just to kind of give you guys some really good case study practice. Okay, so I just have my screen up here. And let's see, I'm going to go towards the end and we're just going to start. Let's start right here. So, we're just going to go over a couple questions. The board exam boot camp was a variety of questions. We have 123 slides of a variety of what you have to know for the board exam. So, special needs, radiography, pharmacology, all kinds of stuff. But this is towards the end, and it looks like we're going to go through some anatomy here, some anesthetic and anatomy. So, let's go through it together. So, a 55-year-old patient presents for a routine restorative procedure. The dental hygienist is preparing to administer a posterior superior alveolar PSA block. When locating the correct injection site for the PSA, the hygienist palpates a bony prominence that serves as a guide. What is the most appropriate landmark to locate for this block? So, I'll give you guys a second to think about it, but if you need more time, just pause the video because I'll be going right into the answer. So, you have to know what all of these different anatomies are. The zygomatic arch, where is that? The maxillary tuberosity, where is that? The coronoid process, where is that? The infraorbital foramen, where is it? But you also have to know when we're doing the posterior superior alveolar block, where are we doing this? So you have to know where to inject it. So, let's see, can I click just using my keyboard? No, I have to do this. So the answer is maxillary tuberosity. Now, if you were looking at the image, this is the maxillary tuberosity right there. So you would have to know what that means, where it's located, and where it's at. So, why is this the correct answer? So, the maxillary tuberosity is a key landmark for this, for the posterior superior alveolar block. The PSA injection site is located just distal to the maxillary second molar. And what is distal to the maxillary second molar? The maxillary tuberosity. That's the only answer. At the height, more specifically, at the height of the mucobuccal fold, and the maxillary tuberosity helps to guide the placement of the needle. This landmark is important for accuracy, targeting the PSA nerve, and achieving proper anesthesia of the maxillary molar. So you need to know all of this to be able to answer the question. Now, the zygomatic arch here, that's wrong because this wouldn't be used for a PSA. This would be used for an infraorbital block. The coronoid process is also wrong because this is located in the mandible, has nothing to do with the PSA block because we're targeting the maxillary molars. And then the infraorbital foramen, well, this is a landmark. So this is for the infraorbital block, which is the anterior maxillary teeth, but it's only going to do the anterior, not the posterior, which is what we were targeting. So as you can see, there are questions, an answer, and then a rationale. So if you're a VIP member, you have this entire PDF file here. You have this entire presentation. And if you ever want to be a part of any board exam boot camps, if you're not a VIP member, we have them, I would say, every 3 months or so, sometimes every 2 months, sometimes every 4 months, but give or take a couple months. And this is how it works. Are you guys ready to go through another question? So this has nothing to do with the question. I just thought it was a super cool video where this is showing you implants. So it's not showing you local anesthetic or anything like that, but notice how it's showing you the different landmarks though. So do you remember where the maxillary tuberosity is? It's right behind the distal here of the maxillary second molar. So I just thought I would break up our studying and show you guys a cool video. Anyway, moving on. So, a patient is undergoing a mandibular block for a lower molar extraction. The dentist needs to ensure that the needle is inserted at the correct site to achieve the most effective anesthetic result. What is the key anatomical landmark used to locate the site for an inferior alveolar nerve block? Would it be the mandibular notch, the buccal foramen, the lingula, or the maxillary tuberosity? So again, feel free to pause the video if you need time to think about it. But you would need to know where all of these landmarks are in order to answer the question. This is where studying and critical thinking comes in. So pick out the keywords from the question. The patient is undergoing a mandibular block for a lower molar extraction. So a block tells you I don't wanna answer the question for you, but no, it doesn't look like I'm going to. So, a block tells you that half of the mouth is going to be frozen. A lower molar extraction, they wanna make sure they're really, really frozen, but the dentist wants to make sure that they're inserting the needle at the correct site. So, the site to is used to locate the inferior alveolar nerve block. Where is that? So, this is how you would answer the question. Mandibular notch. So, why is this the best answer? So, this is critical for locating the injection site for an inferior alveolar nerve block. It's typically administered at the level of the mandibular notch, which is located just posterior to the coronoid process and near the anterior border of the ramus of the mandible. So, the needle needs to be directed towards the pterygomandibular space in order to anesthetize the inferior alveolar nerve, which is what you need to freeze when you're working on the mandibular posterior teeth. So that's why A is the best answer. The buccal foramen isn't correct because it's just not used. If you guys remember where the buccal foramen is, that just is in the wrong spot. The lingula, well, this is a bony landmark. It's not really a site for extraction or a site for a needle, if that makes sense. So it's near the entrance to the mandibular foramen, which is important for the IA block, but not used for a reference when you're injecting. And the maxillary tuberosity isn't correct because we're talking about the maxilla, not the mandible. So hopefully nobody thought that one. Let's go through one more just to really test your knowledge here. A dental hygienist is preparing to take an impression for a study model of a patient's upper arch. The patient has partially edentulous arch with missing first molars. What impression material is most appropriate for this case, considering ease of use and accuracy? So you need to know what each of these impression materials are and what they're used for. So in your studying, if you're like, oh, polyether, I don't remember what that is, then that tells you that you need to go back to dental materials and look up all of these different things that you would use to take an impression so you know what they mean. This is critical thinking because just because I'm asking you this question on the board exam, they could ask you a similar question. So this is just reminding you what you might not know and have to restudy for the exam. So what do you guys think the answer is? It is alginate, and let me tell you why. So, we'll read the question again quickly. So, they're taking an impression for a study model of the patient's upper arch. You don't really have to worry about the other information at this point, just that what is the impression for? It's a study model of the patient's upper arch. The rest of the information is just extra. I think is trying to trick you. So, alginate's the best answer because that's actually the only answer of how you're going to take a study model. The addition silicone, well, you would need the alginate to take the impressions for the study model, but the addition silicone is more for better accuracy if you're doing a crown, bridge, veneer. That's where you use like the light body, the heavy body, the medium body. Now, as a dental hygiene student, you don't need to know every single material 110% like alginate, addition silicone, but you need to know the difference of what they're used for. As an example, if the dentist tells you you're taking impressions for a bleaching tray and you take out silicone, that's not showing you know what you're talking about. It would be alginates, right? As a dental hygienist, you would typically only be working with alginates, but as a dental assistant, you'll be helping the dentist with all of these different materials. But anyway, so polyether is more rigid and less comfortable, and it's expensive. So, why would you use a more expensive material when it's not needed and it's uncomfortable for the patient? And then impression plaster. Well, plaster is used to pour up impressions, not to take impressions. So, that's why alginate is the best answer. So, how did you guys do with that? So, just a couple questions to kind of get you guys thinking. There's lots more mock exam practice inside the course, you guys. Of course, there's tons there, and I am always here if you need anything. Let me know. This was just a quick, practice, and let me know how your studying is going, and I'll see you guys in the next one.